Question 11. You have been assigned to administer a SSE to Mr. Taylor. It has been several months since you have performed this procedure. To refresh your memory, you should refer to the A. Patient Care Plan, B. Policy and Procedure Manual, C. Disaster Plan, D. MSDS Manual. Answer B. Explanation. Before performing any procedure or giving care to a client, you must first be trained and demonstrate that you know what to do. After training, review procedures in the Policy and Procedure Manual that is on your unit or online at your facility. Do not begin a procedure if you aren't certain how to do it. Question 12. As super, Mrs. Sparks needs feeding assist. Her diet is low sodium, mechanical soft. Which food selection is appropriate? A. Hot dog and potato chips. B. Mashed potatoes and a hamburger patty. C. Chicken broth and a bologna sandwich. D. Pizza and a tossed salad. Answer B. Explanation. A diet that is low sodium cannot have added table salt. Foods that are processed, such as hot dogs, sausage, and luncheon meats, are not allowed because of their high salt level. Other foods that have surprisingly high sodium levels include cheese, soup, and salad dressing. Mechanical soft diets are easy to chew and swallow. The client may be too ill, have a swallowing disorder, or no teeth to properly chew the food. Question 13. Right before dinner, a client is incontinent or urine. The nurse aide should A. Clean the client and take to dinner as soon as possible. B. Do a quick change and then clean the client after dinner. C. Take the client to the dinner table and clean up after dinner. D. Assist in that the client eats dinner in their room. Answer A. Explanation. When a client is incontinent of urine, the nurse aide should clean the client as soon as possible. Urine contains ammonia, which is a harsh chemical that can cause skin irritation and breakdown. Ammonia promotes bacterial growth in a warm, moist environment. Bacteria can double every 20 minutes. Question 14. When a client has left-sided weakness, what part of a sweater is put on first? A. Client's choice. B. Right sleeve. C. Both sleeves. D. Left sleeve. Answer D. Left sleeve. Explanation. When dressing clients with left-sided weakness, teach the client to use their unaffected side to dress the affected side first. When getting undressed, take the right side out of the sleeve first. Clothing should be loose-fitting and comfortable. Question 15. Water for the resident's bath should be A. 90 degrees F, B. 100 degrees F, C. 75 degrees F, D. 160 degrees F. Answer B. Explanation. When giving a bath or shower, always check the temperature before assisting the resident into the water. The ideal temperature is about 2 degrees more than the resident's body temperature. Test the water on the inside of your arm to ensure it is comfortable. It is also helpful to warm the room before starting a bath. Question 16. The female perineum should be cleansed. A. With a disinfectant. B. Without soap. C. From back to front. D. From front to back. Answer D. Explanation. Female perineal care is always done front to back. Begin by washing the inner thigh and outer labia. When washing the inner labia, use gentle downward strokes. Use the different parts of the washcloth for each area. Rinse and dry as well. For the buttocks, position the client on the side. Spread the buttocks apart and gently wash the anal area from front to back. Rinse and dry well. Question 17. The best razor to use when shaving a diabetic client is A. disposable razor, B. An electric razor, C. A straight-edged razor, D. A double-edged razor. Answer B. Explanation. It is important to avoid any nicks or cuts when shaving, so an electric razor is the safest way for clients with diabetes to shave. High blood sugar levels and poor circulation cause wounds to heal slowly. Also, bacteria can thrive when blood sugar levels are high, putting the client at risk for skin infections. Question 18. When a nurse aide gives evening care to clients with full set of dentures, proper procedure requires that the dentures be placed A. Under the client's pillow, B. In the client's bathroom on the sink, C. In a denture cup with the client's name on it, D. In a tissue on the client's bedside stand. Answer C. Explanation. Dentures are important for the client's nutrition as well as for their appearance and self-esteem. Handle dentures carefully because they are expensive to replace. After cleaning, place the dentures into a clean denture cup filled with cold water and labeled with the client's name. Do not place dentures in the tissue, they can be accidentally thrown away. Question 19. Mr. Jones is unconscious. What are some guidelines you need to remember when giving oral care? A. Provide at least Q2 hours. B. Explain the procedure to him. C. Clean mouth, tongue, and gums. D. All of the above. Answer D. Explanation. The nurse aide should provide oral care at least every 2 hours to make the client comfortable. Even if you're not certain if the client can hear, explain what you're going to do. Proceed to give to oral care after opening the mouth with a padded tongue blade. Do not use your fingers in case the client suddenly bends down. Use mouth swabs or soft toothbrush to clean the teeth, gums, tongue, and inside of the mouth. Gently rinse with water. Finish with a lip lubricant. Question 20. The nurse aide is caring for a diabetic resident. The nurse aide finds the resident trying to scrape off a callus on a little toe. The nurse aide should first A. Put salts on the resident to keep them from scraping. B. Scold the resident and remind them they are diabetic. C. Help the resident remove the callus. D. Report the behavior to the nurse. Answer A. Put socks on the resident to keep them from scraping. Explanation. Residents with diabetes can have complications from nerve damage and poor circulation. This means they may not even know their feet are injured. Wounds can be very slow to heal. Even a small cut on their feet can develop into a severe foot infection. Diabetics should always wear shoes and socks, and their feet should be checked daily for any signs of injury. Many facilities provide professional foot care specialists for their diabetic patients. Thank you for watching.